It's gonna be good. It's gonna be great. It's gonna be better. I can't wait. Making my move. Live for the day. Sing like a bird. Fly like a plane. Come spill with me, Jenny D.
Hello, my beautiful people. Thank you for joining me with another episode on Spill With Me, Jenny D. This episode is brought to you by Clair Health. As we head into the busy holiday season, which I cannot believe it's here already, we're talking about something we all want. Healthy, glowy skin that reflects how good we feel inside. I'm so excited today. Joining me is Autumn. I'm going to say it right. Groscost,
yeah.
A certified physician assistant who specializes in plastic surgery and has more than a decade of experience in the art of injectables. We'll be talking about some of the most well-known aesthetic treatments and how these treatments can help your complexion stay bright and cheerful, even when life gets hectic during the holidays. So, Autumn, thank you so much for being here. Can we start by saying, a lot of people do feel like, oh my gosh, why do people get into this field? So start by sharing what drew you to specialize in plastic surgery and aesthetic medicine.
Thank you for having me, Jenny. I appreciate this little conversation we get to have today.
So fun.
Initially, honestly, I had very little interest in plastic surgery.
Really?
Yes. In fact, it was so far off my radar, I really knew very little about the field.
Oh, wow.
So as a PA student, we're required to do 9 clinical rotations, and we get to choose 2 different electives. So I was wholeheartedly convinced that I was going to be a cardiothoracic surgery PA.
Okay.
And that I was going to be saving lives and transplanting hearts and, all of that.
Right.
But a week before my clinical rotation in CT surgery, my rotation was canceled.
Oh.
And I got the slim pickings of plastic surgery.
Really?
Yeah. I moped around for about a week. My now husband was like, you'll do fine. It'll be exciting. And I said, I'm really just not the person that's into breast augmentation and Botox,
right.
like celebrity style. It just wasn't my cup of tea. I was more very much natural aesthetics, put my hair in a ponytail, go to work, do
yes.
things. But little did I know I would spend the absolute best 6 weeks of my life rotating with a fabulous surgeon in plastic surgery here in Pittsburgh and, really learning how wrong I was about the field. And then the last 14 years practicing in plastics.
That's amazing. I mean, you always think about this too. Think about when we go to school and we try to major in something, you don't know you're going to love it until you're in it. I had my nephew, he went to school for teaching, realized, what, he didn't want to do it. So now he's doing something else. So until you get in the job,
right,
you can't really define if it's going to be the fit for you until you really,
you get into it. Yeah.
Oh, my goodness.
I mean, I learned a whole lot about what plastic surgery actually was. The definition itself is the art of restoring and reconstructing or enhancing the actual form and function of the body. So, we talk a lot about the aesthetic medicine, but
right.
I think the vast majority of the time I spent on my rotation was really watching patients transform, giving them back something they lost, whether it be a breast after breast cancer treatment, a body after they've lost 100 pounds, a mom, her confidence after having, children and really not feeling like herself and her body due to the changes that occur.
Right.
So I think that's
why do they call it? I'm sorry to interrupt you. Why do they call it plastic surgery? What is the word? Why does it? Because plastic to me sounds like a Barbie. When people say oh, you want to be plastic like a Barbie. Yeah. Where did that word plastic?
I think it's derived from probably a Latin term, really meaning sort of change, transformation, et cetera. It's right. Not necessarily the same meaning that we, consider it in today's modern society.
That is true. That is so true. So you have more than 10 years experience in the art of injectables.
I do.
What do you enjoy most about helping people feel confident in their skin? I know you were talking about like a woman who just, had children, and after that, you do feel your body changes so much as we age. Do you find that, what is the most thing that you feel that when you see somebody, the confidence that they have?
Yeah. So, I mean, my first mentor in plastic surgery was actually the same preceptor that I had during my rotation in PA school. So I was hired right out of PA school. And I worked with him for about 10 years before he retired. And he really had this thriving injectables practice. So it was sort of a secondary thing for me to get into. I wasn't super excited about it at first. I do myself have a phobia of needles. So I was like, I don't really know if I want to be putting needles into people's faces. But,
I know, right?
He really taught me everything I knew. And the first solo injection that I did as a provider was actually a lovely, fabulous, inspirational woman who had been getting injectables after a horrific burn to her face from a car accident. So, she came to us, we evaluated her, we discussed, treatments, and it was going to be a stepwise process, right? So when we did her, if we did a few injections, watching her walk into our clinic with a smile on her face, someone who had been hiding her face for as long as she could remember after this accident, was just one of those aha moments. Like, yes, wow, you really made a huge difference with just a simple treatment.
Right.
And so from that on, it really kind of fed my passion of you can make a big difference with a simple tool.
I love that, Autumn. That's so true. I didn't even you don't think about the other side of like someone who has like a deformity or something that they've been living with and they've been trying to hide it. That's amazing. Thank you for sharing. Yeah, of course. The holidays are joyful.
Yes.
But, we know this. We both have kids. It's very incredible. It's stressful. And there, how can factors like late nights, travel, cold weather, and maybe even sugar overload impact our skin?
Right. It happens to us all, right? I mean, the crunch of holiday time, shopping, the weather getting cold, et cetera. But
Pittsburgh.
Pittsburgh and the graying is happening. So, but you have to think about your skin is your body's first line of defense, right? It's the biggest organ in the body, but it's the most easily neglected, especially as we get busy, particularly during the holiday season. So all of these stressors, lack of sleep, increased amount of coffee that you're drinking, the dry humidity, dry heat, all of those things can damage the skin's ability to really produce collagen and elastin, which are, the biggest factor in youthful appearing skin.
Right.
So ultimately it leads to dry, flaky complexions, and it's really the perfect storm for the formation of wrinkles, fine lines, redness. I think so a well-rounded, consistent skincare routine is absolutely imperative.
Right. Because I don't, when I was younger, I didn't think anything, I didn't put moisturizer or anything like that on. But I feel like it's not even just your face. It's your whole body.
It's your body, right? Yeah. Your skin covers your whole body.
Right. Just getting lotion on, it's funny because sometimes I always put lotion on my legs and my arms, but I'm like, I wonder if people were able to how do you put lotion on your back?
Yeah, right?
I guess your back.
They make a tool for that.
They probably do. They make something for everything, right?
Yes.
For someone looking to refresh their appearance before the holidays, how soon before an event should they schedule treatments?
Sure. So our practice offers various non-surgical interventions, and that includes injectables as well as our newest edition of the SkinPen, which is the first FDA-approved microneedling device. And for each treatment, there's sort of a different timeline. Botox or Juveau, which are the two neuromodulators that we utilize in our clinic, have a waiting period before they take full effect. So Botox takes 2 weeks to fully kick in, and Juveau about a week. So I generally recommend patients receive their treatments about 2 to 3 weeks before they're looking to be fully refreshed.
So wait, why wouldn't you want to do the one that's only a week?
Well, there's, different factors to decide which one works best for you. A Juveau this is a question later on in the section here, but Botox and Juveau are both neuromodulators. And I think the biggest difference between the two is how far they spread or diffuse into the muscles.
Oh, right.
So, Botox diffuses to about the size of a quarter, and Juveau diffuses to about the size of a dime. So I usually recommend for patients who don't want that fully frozen appearance or who don't have deep fine lines and wrinkles, that Juveau is probably a better product for you.
Okay.
Personally, Botox is my tried and true, and I love to use it. I feel like I get the most consistent results with it, but I have a handful of patients that say, Juveau is really their favorite. I think comparatively, the length of time that they last is about the same.
Okay.
But it's really, what are you looking for? What are the results that you're most interested in achieving?
That's so funny because I'm not even sure which one I use. I've got mine done. Mine usually lasts about 3 months.
Yep, 3 to 4 months is the average.
It's definitely
time.
the forehead. I get the 11s they call, right?
Yeah, your 11s.
And, the wrinkles near your eye.
Sure.
Yes, but I always said I didn't want to look like when I was laughing or smiling. I don't want to look like I
still want to be expressive.
Yes, expressive.
You don't want to be frozen.
Yes, that's the word, expressive.
There's a couple other products on the market that, other practices use. Things like Dysport is a big one. Xeomin. You'll also hear a lot about something called Daxify. I think that in our practice, we've chosen our 2 favorites. Like I said, where we get the most consistent results and, feel that in our hands, they, work the best.
Right.
Of course, other providers may vary differently.
Right. So the word injectables can make people nervous. I know it makes me nervous.
Mm-hmm.
What would you say to someone who's curious about or hesitant to try these treatments?
Sure. Injectables is a very scary word. I really prefer non-surgical interventions because it kind of, takes away that stigma of, you're getting a needle put in your face. But the process it's not as scary as it sounds.
Right.
So my goal when you come in for treatment is to really make you as comfortable as possible. So, for our Botox treatments, it feels a little like a bee sting. It's quick. It's straightforward. I am incessantly chatty during injections to try to use the distraction technique to make sure people are, having trouble. But for our fillers and even our microneedling, we do offer a topical anesthetic to help make the process more comfortable. And a lot of our filler products actually include lidocaine in the injection so that as the process goes forward, you're more comfortable with the injection sites.
Okay. Yeah, I didn't even think about that. But when I got it done, I remember I felt like I could feel it moving or something. And I thought, am I just imagining that I can feel some type of liquid or something? Or
Botox can sound crunchy when it's injected. And I think it's just a, product of the anatomy is, where we're injecting it. A lot of people, especially in the 11s, when we do the procerus muscle right in the middle, I warn them saying this may sound a little crunchy when we inject it. But I think just educating patients on how the process is going to be makes things a little more comfortable for sure.
Right. And I remember, we were talking about this off air, but I remember being that person like, I would never do that.
Yeah.
Never say never. Yeah, because it is true.
Yeah.
Once you do it on them, like it's almost like you're like, wait a minute, I see this wrinkle, I see that, or I know the neck and this and that. Like I could be there all day just trying.
Yeah, you get hooked for sure.
You do. You definitely get hooked because you do feel so much better and bright. I actually think, and I don't know if this is true, and you can tell me if this is true. I feel like my face feels shinier.
Yes.
Like brighter.
Mm-hmm. It's certainly a byproduct of the Botox. I think once the goal of Botox or any neuromodulator that you would have injected is to paralyze the muscle that creates the fine lines and wrinkles. So when it's injected and that muscle is no longer moving, it gives the skin sort of a tightening effect. And it appears, smoother, healthier, glowy. And it's a fabulous effect.
If you're not watching this on YouTube, you should see Autumn's face. It's so beautiful. She's glowing. She looks like she just came from Florida.
Yeah, right. I wish. It's really cold outside.
I know, right? We could just dream.
Right.
So let's talk about the 2 most common aesthetic treatments. We were talking about the Botox and the fillers.
Yes.
Now, how do they work and what kind of results can patients expect?
So we touched a little bit on Botox and Juveau, some of the other products like Dysport or Xeomin, all of which are the neuromodulators of the neurotoxin, which is the medication that paralyzes the muscle. Each of those works in the same way. It's just how they diffuse or spread into the muscle that really varies. Botox generally takes 2 weeks for full effect and lasts approximately 3 to 4 months. Juveau is, as soon as 3 to 4 days, but about a week for full onset and lasts about 3 to 4 months. Our practice doesn't currently use Dysport because, I think that Botox and Juveau, their conversion rates, the number of units you need to inject is the same, where Dysport is a little bit different. It varies in price and it diffuses to about the size of a quarter. So I feel, at least in my hands, that there's a little bit higher risk of asymmetries or eyelid droop, et cetera, when we use Dysport. So we stick to the Botox and Juveau. But fillers are a whole different ballgame. So they do exactly what they are called. They fill an area. They create a plumping effect and, can actually fill fine lines, wrinkles, and give volume to the face.
So you can put fillers all over your face?
Not necessarily.
Okay.
So lower face, cheeks, jawline, what we call the nasolabial folds, or the lines around your nose, marionette lines underneath of your mouth, lips are the general go-to areas for filler.
Okay.
So filler is a product that is made of hyaluronic acid, which is a substance that lives in your body. And its goal is to really take up water. So it takes the water from your tissues and causes that plumping effect. But it's a gelatinous, it's gel-like material. So when you inject it, you're actually putting that foreign body into your tissues, and you want to make sure you're not putting it anywhere where there's very important anatomic structure.
Oh, wow.
Right. And you want to put it in an area where it's not really going to be seen, right?
Yes.
So places like the forehead, that's a really compact space where there's really no tissues between the skin and the bone,
right,
is really a kind of a no-fly zone for fillers. Areas where you can get into big blood vessels, like around the eyes, say in between the eyes.
Right.
We usually don't recommend putting fillers into those spaces, just because the risk, of intravascular injection is a little higher. We don't want to make anybody blind. We don't want to make anybody, have significant complications. So really fillers are most applicable to the lower face.
Okay. Yeah, because the lips.
Right.
And I was just talking to Adam about my lips. I need mine filled. Okay. I'm just so afraid. I always think it's going to happen to me, like a horror story. I'm going to have too much or something on my lips. But it doesn't stay, like it actually will, it'll come down.
So because the filler is a natural substance that occurs in your body, generally it's broken down over time. So in our practice, we use products that are made of the hyaluronic acid. You will find other substances out there that are made of things like hydroxyapatite, which is a product that's in bone that gives a little more structure to the face or to where you're injecting it. Those are a little harder your body doesn't break those down as readily. But filler generally lasts about a year.
Oh, really?
Yep, they can last about a year.
Oh, because I was thinking, because with Botox lasts them like 3 months or whatever, 6 months with some people. I was thinking it was the same time frame with fillers.
It lasts definitely longer. And, I think desired effect, it does get broken down over time. So that initial result that you see about a week after injection, you will gradually lessen. So we have patients come in a little bit more frequently than a year, but I think for the most part, it's still present at that point in time.
And it's better to add.
Yep.
Because once you have it in there.
I like to be conservative with my injections. Certainly, I'm not a girl that's going to put 3 syringes of filler into your face in your first office appointment. And I think a slow, gradual, result is a much more natural result than.
Have you ever told anybody, Autumn, look, this is too much. Like, you don't need that much.
Yes.
Yeah. I was going to say, because sometimes I will see somebody and I'll be like, I'm like, their lips are way too full. I mean, I would never say anything to them, but it's very noticeable to me. Like sometimes you can see the side view of it.
Yeah.
And it's like, I wonder if they know, the people are seeing that, or did they not? They probably don't even care.
I think everyone has their own, preference for aesthetics, but, I know in my hands, I'm very upfront with patients. If I don't think you need it, then I'm going to tell you that I don't think you need it, that I don't want you to spend, a significant amount of money on something that really is, you could regret, right?
Right.
That may change the function of your face. Your ability to smile, your ability to make, words and sounds.
Right.
As the lips get bigger, certainly that changes the way that you vocalize your sounds.
But that's so wonderful. Thank you for being honest with people too. Because, a lot of times, in businesses, with aesthetics and stuff, a lot of people are like, why wouldn't your doctor or why wouldn't somebody tell you like, hey, listen, you have enough or you don't need this, I love that you're honest like that.
Yeah. I like to make sure patients' faces are balanced.
Right. Because it's your name too. Like if they go out in the public and say, hey, I got mine from.
Yeah. I think facial balancing is really important. So, when those ratios get a little off, you don't want to be, trying to backtrack for sure. Exactly. It's much harder to do so.
That is.
Lips and cheeks are my favorite injections to do, but if I have to say no, then, what's best for the patient is what matters most.
Right. Oh, gosh. Thank you so much. Now, okay, I'm interested in this. The SkinPen. Microneedling is another treatment gaining popularity that you recently introduced. Can you explain how it works and what kinds of improvements it makes?
Absolutely. So this is my new baby.
Oh, I know. Tell me about the new baby.
So the SkinPen is the first FDA-approved microneedling device that utilizes your skin's own natural healing process to remodel and brighten your skin. The device looks like an overgrown electric toothbrush and it sounds like one too. Mm-hmm. It is fitted with a disposable head that includes 9 sterile microneedles that penetrate the skin at adjustable depths, really depending on where we're utilizing it, mostly for the face and the neck. And it creates tiny little microchannels that trigger the repair cascade under skin that leads to increased production in new collagen and elastin formation. So really the goal is to make the skin more firm, resilient, and youthful.
Okay.
And it's recommended that patients have 3 to 4 treatments, at least 3 to 4 weeks apart to really kickstart that cascade. And the results can continue for up to 6 months as your body continues to remodel the skin.
Okay.
So it allows the skin to look better and brighter after each session and, gives you a sort of kickstart to start making your own collagen instead of having to take it orally or, have it put into your skin through filler.
Okay. So that would be something you wouldn't do Botox and microneedling.
I usually stagger them, right? So patients can certainly have I think both treatments complement each other. It gives you that brighter skin. Botox, allows you to have that, more relaxed, refreshed state while the SkinPen continues to do its great work. But I wouldn't do them on the same day. No.
Right.
Yeah.
Okay. Now, I don't even know if this question's in here, but do you have like a certain age where you tell people or is there a certain age that people should start doing Botox and fillers?
I have patients in all age groups. Mm-hmm. I see the 21-year-old who's coming in saying, I would like to start my prophylactic Botox now so I don't get wrinkles. And I have the 80-year-old woman that comes in that, says, pump me up. I don't want to look like I'm 80.
Yes.
So I don't have a real cutoff. I think injectables in patients under the age of 18, I don't really want to have, parents coming in signing consents for patients because you do have to sign a consent for the procedure. But I think really there isn't a time frame after that I would say definitely not.
It's preference, Mm-hmm. You want to enhance your looks or you want to do something, it doesn't matter. Yeah, I do believe too, maybe over 18 because you're still kind of like, growing, forming and
figuring out your own decision-making process, etc.
Right. And I don't know if they have the money at 18.
Right? I know I did it.
I know. Maybe mommy and daddy do.
Yeah, I know I did
For Christmas, I'm going to buy you fillers.
Yeah.
I think we might have touched on this already, though, but what's your philosophy on achieving natural balance results, especially when patients want to look refreshed but not overdone?
Mm-hmm. I think the body is a beautiful thing and too much product can draw attention to all the wrong things, right? So, my philosophy is really, we talked about facial balancing and making sure that we're just augmenting your natural results. I want to make sure you look and feel your best. And I think the decision to overdo things, doesn't necessarily always come from the most positive place, right? So, a patient who wants to come in and completely change their facial structure probably isn't someone that would do well in my hands.
Right.
I want to take your natural beauty and just enhance it versus completely changing who you are.
I love
the
that.
outside.
I love that line. You want to enhance her natural beauty?
Yeah.
Yes. Oh my gosh.
I think the greatest compliment that someone can get, especially after they've had a treatment, is, they walk into a room of family and friends and someone walks up to you and says, wow, you look different. I can't quite put my finger on what's going on.
Yeah.
What are you doing?
Right.
And I think that's the best compliment.
That is the best compliment. And I do, after starting with my treatment a couple of years ago, I feel like sometimes I'm like, oh my gosh, I got to get it done. Like I can start feeling it, but it's one of those things where I feel like I look at pictures before and I'm like, wow, why didn't I do this a long time ago? Yeah. Because it does, I feel like I look younger than I did back then with having Botox.
And a lot of patients, they come to me and they say, look, I've been working so hard in my skincare routine, my exercise routine, like getting my energy back, really trying to encourage, positive mental health, et cetera. But when I look in the mirror, I just don't feel on the inside. I don't look on the outside the way I feel on the inside. So, those are my favorite patients to treat because I can help you with that.
That's right. Yeah.
I can give you that refreshed appearance and show that you have been working really hard and have that positive vibe about you.
I love that because I do believe when we were talking about mental health that, that we should not judge because you don't know what somebody's going through. Mm-hmm. And this may make them feel to have that confidence that they needed to boost, how they're feeling.
And I'm certainly not one to say like, oh, I think you need this treatment. I want to listen to what patients are asking for. And then we can tailor a treatment based on that. Right. I don't want you to come into the office and be like, what do you think I need? Because I'm going to tell you look beautiful. Right. And I don't think that you need anything.
Circle here. Do you need here?
No. What are your goals? How do you feel? What do you want to achieve from this product or from this treatment plan?
I love that. So true. Because I'd be like, Autumn, what do you think I need? I would just be like, say, okay.
You're beautiful, Daddy.
You're so sweet. At St. Clair Health, you provide comprehensive consultations regarding skincare needs. Mm-hmm. How do you guide someone towards the best plan for their goal?
We talked about skin being your first line of defense. It's the body's largest organ. I think skincare is really the foundation of beauty, right? It's the foundation of the house. It's, what
you see the first thing
it's the first thing you see. I think that a skincare routine, it takes some work initially, but once you get there, it can really speak volumes for itself. In my opinion, the two most important skincare treatments that your essentials is a great moisturizer and sunscreen. If you have those two things in your toolbox, then I think you're certainly on the right track. And it doesn't have to be an extensive, expensive skincare routine, right? Personally, I've struggled with my skin for a long time. I was diagnosed with psoriasis. And so I really struggled to find products that were all natural and weren't going to make my skin just look like it was on fire all the time.
Right.
So I use a simple Cetaphil or, CeraVe, dermatologist recommended products, or Aquaphor, which my office will tell you I should literally be the spokesperson for Aquaphor. And then sunscreen.
So you think we should wear sunscreen all year round?
All year round. UV rays are there even when there is no sun.
Yeah. Well, like in my foundation, it says SPF. Okay.
Yep.
That's what I was thinking. I think it's so hard, like as women, as men, when we see the commercials on TV and they're like, this, if you put this under your eye, you will not have any wrinkles. And you're like, do I believe this or do I not believe this? So I think that to me, you could, like you said, you could spend so much money on the skincare routine that's not really getting the benefits that it's saying that it's going to give you those benefits.
Right. Another product that I recommend often is Retin-A or tretinoin, which is a prescription medication that comes in different strengths. And its job is to really help increase the cellular turnover of your skin, which is something that our microneedling device also does. And it just allows your skin to sort of remodel itself, during the treatment process. Now, Retin-A can be a little bit of a tricky fella, and it takes a little bit to get over the hump because it can create a little bit of peeling, right, and some redness of the skin initially when you're first using it to treat. So I recommend that patients start off at the lowest dose and then use it, say, at night every 3 days for 2 weeks, and then increase that to every 2 days for 2 weeks, and just kind of help them get over that hump.
The dryness, yes.
Yeah.
Do you treat people with acne or with what is that called?
Rosacea.
Yeah, rosacea.
I don't primarily treat those patients, but I see a lot of patients with those skin conditions that come to me for Botox, for filler, for the microneedling. One of the fabulous aspects of the microneedling device is its ability to help with acne scars.
Oh, okay.
It's marketed, and there's a lot of research showing that it can really decrease acne scars. And if you look at their website, there's a lot of tremendous data and results on what that looks like. Now, acne scars take a little bit of extra time to treat, because depending on the depth and how significant they are, but it's a fabulous tool for that.
I love that. I love that that's out there. Finally, what do you want people to know about self-care and confidence during the holidays? A time when we're often putting everyone else first, and we're kind of putting ourselves on the back burner.
Yeah, absolutely. I mean, I think self-care is crucial all the time. Yeah. Not just during the holidays. Of course, this is the season of giving, but in order to really give to others, you got to take care of yourself first. You can't have someone drink from an empty cup, right? So
I love that.
I think that you have to have a full tank yourself. It's really essential. So it's a mantra that I personally practice myself, and I'm really not afraid to promote it to other people, but self-care is crucial.
I love that. Everything you've said too, Autumn, like I'm taking it all in as well. And I'm thinking to myself, it's so true. Because it's, sometimes as women, maybe me speaking, I felt guilty. I was like, oh my gosh, I shouldn't be spending money. I could be spending money on something else. And here I'm going to get Botox for myself. And selfish. But like you said, if we're not feeling good,
right,
everybody around us, will notice that.
Right.
So we got to kind of put ourselves first sometimes.
Absolutely. Agree.
I love that. Thank you. Is there anything else that we didn't touch on you'd like to talk about, or?
No, I think like I said, these are just sort of my babies. The skincare treatments, the SkinPen, the Botox and fillers is something that I provide in the clinic as an autonomous, PA provider. It's an aspect of the practice that I'm very passionate about. So I see patients in the office on Wednesdays for injectables and for, SkinPen treatments. I do have a scheduling ability online. If you visit the St. Clair provider website, you can schedule with me for a consult. I am happy to talk to you about, the treatment options that are available, and we can discuss what's best for you.
Yes, I love it. Thank you so much. This was so wonderful. Thank you for joining us today and sharing your expertise, Autumn. It's clear that aesthetic medicine is about so much more than looking good. It's about feeling good, restoring confidence, and taking time for yourself, especially during a season that can feel overwhelming. It's getting close. If you're interested in learning more about aesthetic treatments with Autumn, or if you'd like to schedule a personalized consultation with St. Clair Medical Group Plastic Surgery, visit stclair.org/plastic surgery or call 412-572-6164. Thank you so much for being on Spill With Me, Jenny.
Yeah, of course. Thank you for having me.
And thank you for joining me with another episode. And thank you, St. Clair, for sponsoring and being my partner. Take care.
Come spill with me.